Good afternoon, everyone. How are we feeling today? Good to see you all. So welcome. If we've not met before, my name is Becky Pritchard. I'm a physiotherapist that specialises in injury rehab, and today we're going to be talking about making your hips a bit more mobile. So if you struggle with issues in your hips, maybe pain, maybe restriction, or if you have low back pain, then it's really important that you have really well moving hips. What we tend to find is if there's a lot of rotation in your hip, either moving inwards like this or outwards like this, it can have a massive effect on your lower back. And quite often you will get pain in your lower back on the side that is stiffer in your hip. So say you have one hip that's restricted, it doesn't roll in or roll out very well, then because you've got a loss of mobility in that hip, then the lower back has to compensate, and then you get pain, stiffness, discomfort on that side. So today I'm going to teach you a very, very simple, gentle exercise to mobilize your hips. Now, if you've got a hip replacement, or if you've got very arthritic hips or lots of pain in your hips, it's really important that you just stay gentle, small, in a pain-free range. So if you want to try it now with me, either lie down on a bed or lie yourself down on the floor, and let me talk you through this exercise. So I'm going to lower my camera down. Welcome to my home studio. Come down and join me on the floor. So you may want to support yourself on pillows or cushions for this. If you've got a mat, place one foot on either edge of your mat if you've got a yoga mat. If you don't have a yoga mat, just wider than the pelvis, as wide as is comfortable. You're going to lie yourself down, take your arms nice and wide so that you're stabilized and you're supported. And you're just going to start by doing a really gentle movement of the knees in the same direction, to the left and to the right. So one knee, this one for me, is rolling in, or one hip's rolling in, and one hip is rolling out. So we're working on the outward rotation of one hip and the inward rotation on the other. Now, if you've got any canching or any pinching in your hip, if there's pain there, don't go into the pain. So how far can you go before that pain triggers? Now for me, I'm quite bendy in my hips, so I'm going to go right to my end of range, which is quite a long way. When you get there, if you can, I want you to do a really big squeeze of your bottom, and this releases the hip, the front of the hip flexor on the leg that's fallen into the center. You're going to come back through to the center and go across the other side. Go as far as is comfortable. You may not get as far as me, and then a big squeeze at the bottom. Now you may not feel much of a stretch, and that's probably because you've not got your feet wide enough. So if you step your feet wider, you're going to feel a little bit more. And you can just keep going with this for as long as you feel comfortable. Maybe a minute, maybe a couple of minutes. The more you squeeze your bottom, the deeper the stretch here. And you can hold that static stretch there. So we're releasing the front of the hip, all the muscles there, as well as mobilizing the joints of your hip. So just gently rolling those knees from side to side. At your furthest point, you might feel some stretch or tension in the back. As long as there's no discomfort there, it's a gentle pull. That is absolutely fine. And that, my lovelies, is all I wanted to teach you today. So I call this one wide knee rolls. It's really good for mobilizing your hips if they're stiff. It's really good to therefore release tension in your lower back. If you do this every day for a month, you will notice an improvement in your hip mobility, but also some of the tension that you are holding in your back. So I wish you a wonderful day. That's all I had to share with you today. It's simple, it looks easy, but it's so effective. So any issues with your hip or your lower back, give that a go. If this is useful, please share that information with a friend. If you know someone with hip or low back pain, maybe tag them in, share it to them, and I will see you next week. Take care. See you soon, guys.